Turf toe. What is turf toe? Turf toe is a common athletic injury. It is seen at all levels of competition, even among professional athletes. Basically, in this condition, the great toe is hyperextended, the big toe is excessively bent upwards, thus overstretching the tendon underneath the big toe, usually at the level of first metatarsal phalangeal joint, the joint where the big toe bends. In addition, the capsular ligament, a ligament which wraps around a joint to maintain joint integrity, is also overstretched, and it too becomes painful. Typically, turf toe is seen in athletes who do a lot of running and quick pivoting, such as a running back in football or perhaps a soccer player. If the particular step by the athlete also involves pivoting, this further aggravates the plantar structures, the soft tissue structures underneath the bone, in this case the tendon and capsular ligament, by grinding the soft tissue further into the hard surface. In some cases this can actually tear the capsular ligament. Some athletes will remember the exact time the injury occurred. In other athletes, it may be the result of the cumulative effect of playing a game and they do not really notice it until afterwards. Typically, the patient will complain of pain and swelling in the affected area. There will also be limitation of motion of the great toe. The diagnosis itself is easy enough to make, but an X-ray is helpful to make sure there is no fracture. This condition is classified according to MRI findings. X-rays are not really helpful in this situation as they do not show damage to ligaments and other soft tissue. An X-ray may be helpful, initially, to rule out a fracture, particularly of one of the sesamoid bones. Grade 1 irritation of the plantar plate. MRI reveals edema, mild sprain-like findings to the plantar plate. Grade 2 partial tear. MRI reveals a partial tear of the plantar plate structure. Grade 3 complete tear. MRI reveals full thickness tear to plantar plate. Treatment of turf toe. Cessation of sports activity. Treatment consists of cessation of the sports activity, usually for about 3 to 4 weeks in a young athlete, possibly longer in an older individual. Physical therapy can be very helpful in speeding up the recovery period. This will help reduce the pain to a manageable level. Anti-inflammatory medication, short-term basis, is very helpful. Taping the big toe to limit the motion of the joint. A podiatrist, athletic trainer, or physical therapist should be able to perform this. Rigid shoe. The patient should wear a rigid shoe which will not allow the big toe to overextend. Many times a cushioned arch support is added for additional protection. The problem with turf toe is that it can recur. Read the complete article at www.foot-pain-explained.com/turftoe.html.